Hey everyone, welcome to the PTCB Prep Guide. Today we are going to build a visual study guide to help you absolutely master the most common hypertension meds you'll see on your exam. Our goal, make these drug names stick in your brain for good. All right, let's just jump right into it with a big question. You've probably heard high blood pressure called the silent killer. But why? Well, it's because it often has zero symptoms. I mean, none, until some really serious damage like a heart attack or a stroke has already happened. And, understanding that is absolutely key to knowing why these medications are so incredibly important. So let's break down the main term here, hypertension. It sounds fancy, but really it's just the medical name for high blood pressure. All it means is that the force of the blood pushing against your artery walls is just consistently too high. This forces the heart to work way, way harder than it's supposed to. I've got a great way for you to picture this. Think about a regular garden hose, right? Now imagine you kink it or step on it. What happens? The pressure builds up like crazy behind that spot. That is exactly what's happening inside your arteries with hypertension. And that constant high pressure, well, that's what leads to damage over time. Okay, so what are we aiming for? This is the number you need to know, 120/80. That's considered the benchmark for a normal, healthy blood pressure. That top number, the 120, is called the systolic pressure. That's the pressure when your heart is actually beating. And the bottom number, the 80, that's the diastolic, the pressure when your heart is resting between beats. Now, this chart is super important because it shows how those numbers fall into different categories. As a pharmacy tech, you're going to see these values all the time on patient charts. The big takeaway here is that anything above that normal 120/80 is cause for concern, and it's broken down into these really clear stages of high blood pressure. All right, so to make all of this super easy to digest for your exam prep, here's our game plan. We've already talked about why this matters, the whole silent killer thing. Next up, we're going to decode drug names and classes, then dive into the 5 major drug groups you have to know, and we'll wrap it all up with a final PTCB recall session. Okay, section 2, let's get right into it. Decoding drug names and classes. Honestly, this is one of the most fundamental skills you're going to use every single day in the pharmacy. So here's the deal, and this is absolutely crucial. You've got the brand name, that's the catchy name the drug company comes up with, like Tylenol. Then you have the generic name. That's the official medical name for what's actually in the pill, like acetaminophen. For the PTCB exam and for your entire career, you have got to know both and be able to connect them instantly. All right, time to get into the specific drug classes. Grouping them like this makes them so much easier to remember. We're going to start with 2 of the heavy hitters, what I like to call the water pill and the heart calmer. Yep, we're talking about diuretics and beta blockers. First up, we have diuretics. You'll hear these called water pills all the time, and their job is pretty simple. They help your kidneys flush out extra salt and water. I mean, think about it. Less fluid in your blood vessels means less pressure, right? It just makes sense. The big one you absolutely have to know here is hydrochlorothiazide, and the brand name is Microzide. Next up, let's talk about beta blockers. The best way to think about these is like a calming agent for a heart that's just working too hard. They literally help it slow down and beat with less force. The 2 you're going to see over and over are metoprolol, that's brand name Lopressor, and atenolol, which has the brand name Tenormin. So, how do they actually do that? This breaks it down perfectly. First, they block the signals from adrenaline, that fight or flight hormone. When that's blocked, it causes the heart to beat slower and with less force. And the result? Lower blood pressure. It's a really simple but super effective chain reaction. Okay, get ready for your first big memory hack for the exam. This is a good one. Look at the end of the generic names for beta blockers. They almost always end in olol, metoprolol, atenolol, propranolol. If you see olol, you should immediately think beta blocker. It's a super reliable pattern. Okay, on to our next 2 classes, ACE inhibitors and ARBs. I want you to think of both of these as the vessel relaxers. Their main job is pretty much the same, to help relax and widen the blood vessels, which gives the blood more room to flow through. So ACE inhibitors are a real workhorse when it comes to treating hypertension. What they do is they stop the body from making a specific chemical that squeezes blood vessels. No chemical, no squeeze, so the vessels relax. The 2 you will see all the time are lisinopril, which has 2 common brand names, Zestril and Prinavil, and enalapril, brand name Vasotec. And you guessed it, we've got another pattern to look for. This is a huge suffix for your exam. ACE inhibitors almost always end in pril, lisinopril, enalapril, captopril. Recognizing these endings is a total game changer. All right, now let's talk about ARBs. They get you to pretty much the same place as ACE inhibitors, relaxed blood vessels, but they do it by working on a different spot in that whole chemical chain reaction. The key examples you need to lock in are losartan, which is brand named Cozar, and valsartan, brand named Diovan. And look at that, another super easy memory trick for you. Just look at those names, losartan, valsartan. ARBs have their own special ending, sartan. Seriously, if you can just remember pril for ACE and sartan for ARBs, you've basically just mastered 2 whole drug classes. It's that simple. Okay, on to our 5th and final drug class for today, the calcium channel blockers. Let's dig into how these guys work to lower blood pressure. So here's a quick biology lesson. Calcium is what helps muscles contract or tighten up. So what these drugs do is they block calcium from getting into the muscle cells in the heart and the arteries. And if calcium can't get in, those muscles can't tighten, they relax. And relaxed arteries, well, that means lower blood pressure. The absolute most common one you're going to see is amlodipine, brand name Norvasc. And of course, for our last class, we have one last suffix to remember. The key for recall here is that many of these common calcium channel blockers end in dipine. Amlodipine is the perfect example. Spotting that ending makes them so much easier to pick out on your exam. All right, we did it. We've gone through all 5 major classes. So now, let's put everything we've learned together on one single powerful summary slide. This right here, this is what you need to burn into your memory for exam day. Seriously, think of this as your ultimate digital flashcard. Go ahead and pause here, take a screenshot, do whatever you need to do. We've got the class, the key, generic and brand names, and most importantly, those game-changing suffixes, olol, pril, sartan, and dipine. If you can master this chart, you are taking a giant leap toward passing your PTCB. Okay, so to wrap this all up, let's do one final check. Imagine this. A patient comes up to the counter and hands you a prescription for Norvasc. As a top-notch pharmacy tech, which generic name and drug class should immediately pop into your head? Think about it. If you said amlodipine, which is a calcium channel blocker, because you saw that it ends in dipine eventually, you are absolutely on the right track. That is exactly the kind of connection you'll be making all day, every day.